Good morning and welcome to IKD 106.1 FM. It is the issues, and this is how we do it every Monday through Friday from 11 a.m., where we talk about matters that concerns our nation, matters that concerns you, matters that concern myself. And of course, every Thursday we talk about healthy conversations. This is in line with the General Hospital Ikorodu, where we have our doctors tell us how to live a healthy life. Today as well, we would also be talking about what many of us call cardiac arrest. In other words, it can be said to be cardiac death. But our focus for today on the issues will be sudden cardiac death. This will be our conversation today on the issues here at IKD 106.1 FM. Do not forget that you can be a part of this broadcast from wherever all over the world by joining our website www.ikd1061fm.ng. That is www.ikd1061fm.ng. We are also very much available as I speak on Facebook. That is IKD1061 FM, IKD1061 FM on Facebook, where we talk about sudden cardiac death. This conversation is very important because record shows that a lot of people out there have passed away due to this cardiac arrest, cardiac death. Ignorance is the word because this is something that could be prevented in a way or the other. But then it is also very important for us to join every other person all over the nation to celebrate our teachers. Today has been set aside as the fifth day in the month of October to celebrate all teachers in Nigeria. So we join the rest of the nation to celebrate all of our teachers. And the reason for this is because even when we talk about healthy conversations, our doctors, just like we had it earlier today in the studio, our doctors were also trained by teachers. Every profession, every field for professionalism was would, in a way or the other, have actually gone through the teaching process by our teachers. So, from all of us at IKD 106.1 FM, we celebrate every teacher out there from the primary to the secondary, both public and private schools all over Nigeria. We celebrate them, and of course, we wish them the very, very best. It is still the issues on IKD 106.1 FM, and of course, this conversation will begin. Stay tuned with us as I go on a very short breather. 106.1 FM, celebrating all of the teachers in the nation today. Of course, today is their day. So, for those of you that have teachers around you, learn to celebrate them. Moving straight ahead to the conversation today on the issues where we talk about sudden cardiac death. My guest in the studio is no other than Dr. Lukman Karim, who happens to be a consultant, a physician, and a cardiologist from Ikorodu General Hospital. We would have this conversation together. I told you earlier that this sudden death that happens to be cardiac death is something that could be prevented. It is something that we could avoid if only we are aware. And the reason for the conversation today is for us to know the causes of what we call cardiac death, how we can prevent this cardiac death, the things we should do as people that are around, people that might be involved in this. All of these and more we will discuss today on the issues. My name is Opeyemi Adebambo, and my guest today is no other than Dr. Lukman Karim. I told you he is a consultant, physician, and a cardiologist from Ikorodu General Hospital. Good morning to you, sir.
Good morning.
It's good to have you again in the studio.
Pleasure.
Thank you very much for joining us. Doctor, to start this conversation first, I want us to clarify the air. When we say cardiac death and heart attack, are they the same?
They are very similar.
Okay.
They can be said to be the same, but there are other causes of sudden cardiac death that may not necessarily be heart attack. But the leading cause of sudden cardiac death is heart attack.
Because I discovered that a lot of people mix them together. Some even say they are intertwined, that they are the same. When you say heart attack and you say cardiac death, that they are the same. So I just needed that clarification to be sure.
The more than to put a value to it, more than 70% of times when you have sudden cardiac death, it's usually as a result of heart attack.
Heart attack.
And in fact, the one we have that is very common around us is usually caused by heart attack.
Thank you very much. You just heard the voice of Dr. Lukman Karim. He's no stranger when we talk about the issues every Thursday in the studio here. And we will talk about cardiac death today. Dr. Lukman, if cardiac death is not so the same as heart attack, then what is cardiac death?
Cardiac death is any cause of or any death that result from either issues with the heart,
Okay.
or any other place that is supplied by blood vessels, including the brain and other parts of the body that are supplied by blood vessels. So to say sudden cardiac death is, when you now put sudden before the cardiac death, it means
Yes.
that it is a kind of death that occurs within 1 hour of symptoms. Somebody may have such symptoms as chest pain, and such a person within an hour of the onset of that pain, the person dies. Somebody may have headache. Within an hour of that headache, the person dies. And these are being found to be related to something that has to do with the heart or blood vessels. So that is sudden cardiac death.
So sudden cardiac death has to do with a very short time.
Yes, that's why it is sudden. Ordinarily, there are other causes of death. Heart failure will give some time. If it is well managed, we have patients that have heart failure that have survived up to 20 years, 15 years, even more. But then, so such a person will not be termed as sudden cardiac death. However, for somebody that is otherwise stable, otherwise healthy, you are in a landlord association's meeting, somebody rises to speak and collapses. Somebody, we have gone to the mama's room to wake her up for morning devotion or the morning prayers, and you find her dead with the heart with the hand on the chest.
On the chest.
Or somebody is just trying to make effort, trying to talk, trying to call people to use our attention, and by the time they get there, they find him or her dead. So this is what we term as a sudden cardiac death.
Then sudden cardiac death, what are the causes? What causes this sudden cardiac death? Because with the way you talk about it, is as if it's something that people don't even know that it happens sometimes, and it just happens all of a sudden, according to the word sudden. Then what are the causes of, before we even start thinking of how to prevent it or what we should do when these things happen?
Fine, you have said it. The single most important cause of sudden cardiac death is heart attack. The one we call myocardial infarction, coronary artery disease, ischemic heart disease. They are the same. It does different terminology referring to the same entity. And that is when we say heart attack, it means that so suddenly blood that is supplying the heart itself. The heart pumps out blood to meet other body organs. But then when the heart itself is not getting sufficient amount of blood, that results in heart attack. The person usually will feel sudden, intense chest pain. And the chest pain may go to the left arm of the person, or to the lower jaw, and there may be vomiting. The person may become sweaty, and you see the anxiety in the person. We call it angoniema, a feeling of doom. The person will know that this is going to be the end. They will call for help. So if nothing is done immediately, then such a person may die. A few of them will survive it, but usually when they die, we say this is sudden cardiac death. It's a spectrum. Like you have said, when we see the extreme of the spectrum is the death. When we were talking about the heart attack, heart attack is actually a very wide spectrum. Starting from what we call angina. I'm sure our listeners know it's angina. That chest pain that occurs when you move a short distance, the pain comes on. When you rest, you are relieved. You're trying to ascend the stairs. After a flight of staircase, you have the chest pain. The way the person rests, it subsides. That is the kind of pain we call angina. You see, what makes it angina is the fact that with rest, the pain subsides. Then that is the first. Then the second is unstable angina. Initially, the first is stable angina. The second is unstable angina. At this time, the person actually starts with that stable angina. They moves on to unstable angina. At which time, with rest, the pain will not completely subside. And from that unstable angina to sudden cardiac death, we call them acute coronary syndrome. This ACS, it is a major cause of death, particularly anywhere in the world. And before, in those days, I did a review some years back, and we discovered that before the 1960s, heart attack is not something that is common among blacks.
Exactly.
And I'm sure we're going to get there. Until that time, when we now decided to westernize our lifestyle. Our lifestyle, our forefathers never rested. They always have a farm to go. The ones that are the artisans also go to their place of work and all those things. Until we decided, okay, my work is to press phone 24/7. Until we decided, okay, the only way to enjoy life is to take alcohol. until we then decided that the traditional eba, amala, rice, and those ones that have a lot of fiber are no more tasty and good to us. We want to go the way of the flour-based meals. So that actually increased the incidence of heart attack. So what we call acute coronary syndrome now contains this has this the remaining four altogether. The unstable angina. That is, the pain does not subside. You know, I said this pain will come on when you are walking around. Then with rest, initially when it subsides with rest, that is angina. When with rest now, the pain still persists until you get to the hospital. Maybe with 1 or 2 injection or tablet, the person it subsides. That is unstable angina. Then we now have what we call myocardial infarction itself, which can be a non-ST segment elevation myocardial infarction or STEMI or non-STEMI. Then the fifth one is the sudden cardiac death. So that one doesn't even get to the hospital. They are brought in dead. And the story you will hear is that he or she shouted, and by the time we got there, it's no more. When we are 7, when they come to the hospital, we realize that this person is dead. So all these are the various types of heart attack that we call myocardial infarction or ischemic heart disease or coronary artery disease. So this is the leading cause of sudden cardiac death. Another one that we should mention is also a cause of sudden death is stroke.
Stroke? Yes,
because it also involves blood vessels that takes the blood to the brain. The same process basically. For heart attack, the blood, let me give this instance. The heart itself is an organ. The brain is an organ. The heart pumps blood to all parts of the body, including the brain. But the heart also has to survive. So it needs blood also. So it supplies itself blood. So when the blood vessel that is taking blood to the heart is blocked, we say that is heart attack. When the blood vessel that is taking blood to the brain is blocked, that is brain attack. That is what we call stroke. So stroke can also be called brain attack. Just like we say heart attack. That's why we say these two conditions, we should not take them with levity. We should seek appropriate solution. When somebody has a sudden weakness of a part of the body or the mouth suddenly deviates to one side, you should seek appropriate help. So this is another cause of sudden cardiac death. The other ones I will briefly mention, they can be hereditary. There is a way we look at it, and that is why when we take our history, we usually ask for the history of that person whose first degree relatives, that includes the parents, siblings, or children, die of they have the history of sudden death. Somebody will say my father died before the age of 40. I never even got to meet my father. He died at 35 or 20 something. And what's the cause of death? We don't know. They don't say he slept, he didn't wake up. Or somebody whose father or a first relative dies maybe while playing football or on any competitive sports. Maybe running, the person will just drop. We have had several issues like that, even within the country. Somebody is on the pitch, in the football, the person dies. So such a person has a history of family history of sudden death. So there are some genetic abnormalities that will make the person at risk of sudden death. So when we have this history, it helps us. There are channelopathies. There are some that we may not even get to know until we have scanned the heart of the patient. And such a person, when you look at the heart, it might be very thick. We call it hypertrophic obstructive cardiomyopathy. Such a person is otherwise stable until that time when they say maybe as a teenager, you are running this inter-house sport in schools, the person will now do that, and suddenly the person will collapse. And if it's not appropriately resuscitated, that is the end of that person. So these are some other causes of sudden cardiac death.
Thank you very much, Dr. Lukman. You've done well to do justice to that question. Now, when we talk about this sudden cardiac death, let's go back to where you talked about the chest pain. Sometimes we see people that will tell you that they always have chest pain. Maybe due to the nature of their job. Some tell you that they do heavy man-job, a macho job. Some will tell you because I'm a sports person, just like you said, sport-like persons. There are people that will just tell you naturally, I always have chest pain. And I'll just take 1 or 2 drugs and all. Is this likened to the fact that as a doctor, you can say those that have this frequent chest pain and then maybe after some pills, 2-3 days later, it's gone, but then it comes back maybe after a month. Is that also likened to heart attack? Is that something they should worry about?
Thank you. Last week was 29th of September, the World Heart Day.
Yes.
And we keep telling people, not all chest pains are gentle or silent.
Okay.
Let me tell you this very short story. I saw one of our clients, and when she came to my consulting room, very big this sack we call Ghana must go, load of drugs. Different time I said, Mama,
Wow.
what is wrong with you? Doctor, ulcer. I have
Mm.
ulcer. What is ulcer? Mama, what is wrong with you? Doctor, I have ulcer. She was telling me the diagnosis, and I told her, if I'm just like any other doctor, I would have also treated you for the ulcer. When
For
I
the
now can
ulcer.
bring out your drugs,
Hmm.
several types of drugs for ulcer.
Mm.
When you are 40 and above, you have chest pain, especially central chest pain,
Mm.
come to the hospital for evaluation. Not all chest pain, not all abdominal pain are ulcer. I've seen someone that has pain in the knees that say, what is the problem? Say it's ulcer. So these myths and all those things, not all chest pain are ulcer. Let us come to the hospital for evaluation. I will describe again what the typical ischemic type chest pain is. What kind of chest pain might you have that will indicate the likelihood of having ulcer? Such a pain is retrosternal. It is in the breastbone. This where my thigh is where that sternum is.
Okay.
The pain is just central chest. Yes, that's central chest.
Mm.
Then you also feel the pain. We call it radiation on the left arm, on the left tip of the left shoulder.
Okay.
You can come to the lower jaw,
Okay.
or sometimes even on the left hand. You feel so the pain. We call it radiation. It's like a movement of the pain to that area. Then typically when this pain comes on, you feel a bit sweaty, and the person may feel nauseous, feeling a feeling of wanting to vomit or actually vomits. And then this pain typically comes with activity.
Okay.
You are sitting down fine. You have to do a movement from one place to the other, like from the sitting room to the restroom. The pain comes on, and when you rest, the pain goes off. That is the ischemic type chest pain, and it may signify my heart attack. And I said heart attack is variable. The youngest of that their sibling is what we call angina. Is one I just described now. That angina, the pain will come with exertion. At rest, the person is comfortable. And such a person, when they walk a short, we see them even on the streets. This person is walking, after some time, the person will wait and put the hand around the waist.
Around the waist.
Like, no, I'm just resting. But the person will actually sit down. And what is the problem is actually chest pain. Such pain as angina. If care is not taken, it can progress to now become sudden cardiac death. The pain will come so severe, and the person may not survive that kind of pain. So this is how we describe the typical ischemic type chest pain. So this is to say that not all chest pain are ulcer, even though there are more than 200 causes of chest pain. Sometimes when people come to the hospital, in fact, as a matter of fact, some of the kind of clients that we see, anxiety can cause chest pain. So usually when they come, doctor, I think I have heart attack, this like that. That might be one of the things that we'll see after this program. I think I have heart attack, and when they come, it is just anxiety. But then it should be told by a doctor, a competent one.
Just to be sure.
To be sure. So when you are 40 or around 40, maybe 30, 35, you have that chest pain that fits into this description. See us in the hospital. And we'll do your ECG, we call another test, cardiac enzyme. If it is not heart attack, but this is not heart attack. If it is heart attack, we'll do something in good time, and that will be. I don't know if I have to say here that not everybody that will have heart attack will have chest pain.
Wow.
Yes. Some people, we call it, in those days, we called it a silent myocardial infarction, or we can say silent heart attack.
Okay.
But now, more recently, we have said it is not silent. Well, whatever is silent will not kill. We now call it painless heart attack. It is painless in the sense that, the typical thing is pain, chest pain.
Yes.
But these categories of people will not even feel any pain. Who are these people? Usually, people that are diabetic. They may not feel the pain. And that is why we have seen people that, that's what they will do. I hope you're okay, I'm fine, there's no problem. And the person is going down. So we as doctors, as cardiologists, we have that high index of suspicion to note that this person falls into the category of people that may not have this chest pain. So we'll just go ahead and do our investigations and we'll treat. We have picked several like that. Another category of people that will not feel pain, they are the elderly people.
Okay.
Elderly is anybody that's more than 65 years of age. They may not feel any chest pain. So when our elders at home, it can even be described, not necessarily pain. Somebody can say discomfort. I'm not feeling fine. I know one of my clients will tell me that. I'm feeling funny. That is, and and what is problem? I say I'm feeling funny. So when I am feeling funny, I'll run my ECG. Okay, this is the issue. We'll come to that. So when an elderly says I'm feeling funny, I'm not feeling fine. I have some discomfort in my chest. Let them see a doctor. And the last category of people, maybe I should say that women generally, they may not feel ischemic type chest pain. It does that, and that is why we have said, look, like I said again, you see, there are a lot of paradoxes to this. Some chest pain are not heart attack. That now somebody has the pain, might not be heart attack. Then there are others that will not have the heart attack without the pain. You see, and so that is there is a third caveat again, that there can now be atypical. The pain, you know, I said central chest pain. I mean,
Yes.
somebody will now feel the pain on the right. That is even very far from the heart. Again, when we have that high index of suspicion, this person may likely, I will go ahead and run our test. If it is not good, it is not. If it is, they will go ahead and treat.
Thank you so very much, Doctor, for that major clarification. I also used to believe that if it is heart attack, there is a pain. There's a chest pain. I always used to believe that. Doctor, I want us to talk about age now. Before we even go deep into this conversation, if you're joining us, we're talking about this sudden cardiac death. We are live on Facebook to be a part of this conversation. So you can also see all of the descriptions that have been done here in the studio by our Dr. Lukman Karim from General Hospital Ikorodu. Now, Doctor, when we talk about age now, let's be sure, is there a particular age bracket to those that can be affected with this sudden cardiac death or even heart attack? You know, some will tell you that it's a sickness for the elderly. It is believed so that if it is heart attack, if it is cardiac death, it's for the elderly. Yeah, yes. How true is that?
Thank you very much. This would take me to a discussion on the risk factors. We don't call them causes.
Okay.
The things that will predispose a person to it. For heart attack, it usually affects people that are around the age of 40 and above.
40 and above.
You know, we said heart attack is just one of several other causes of sudden cardiac death. There are other causes of sudden cardiac death that may even affect a 15-year-old, a 16-year-old, a 20-year-old. Like one such condition is what we call HOCM, HOCM, hypertrophic obstructive cardiomyopathy. Is a congenital, is an hereditary thing. It runs in the family. Even occasionally, it comes sporadically. So a child in the family may just have it, while others may not have. But this condition, when this category of people now engages in strenuous exercise, a competitive exercise, they can just drop dead. Because a part of the heart is supposed to pump blood out, gets suddenly blocked. And this can affect, and in fact, typically, you know, the standard is if you are going to engage in active sports, competitive sports,
yes,
you should come for evaluation. You had one recently for a group of people. That's the ideal thing. So that we assess your heart, everything is fine. And, you know, we know of players in this country, our athletes, that have suffered similar condition.
Yes.
So this person on a pitch, this person dies. You understand? If they are not appropriately evaluated, so this is not age limited. The other, this one I said, HOCM, the other channelopathies that are not age limited. For heart attack, it typically occurs around the age of 40 and more. I said around.
Yes.
Traditionally, it has been 40 and more. But now we are seeing it even in younger people. Because again, I said we have now westernized our lifestyle. You understand the thing? Our papa never got to be that big in size because they usually farm. They would trek to the farm that would be like 10 kilometers away. 15
All the
kilometers
edibles
away,
are natural.
and they're natural. But now we have westernized everything. Here on this station, we have said it before. Almost every other house around us here is either one a tree or the other where you hair. So those are the kind of, so for age, it is a major risk factor. And when you are around 40, chest pain comes, don't assume it's ulcer. And that's why some people, they will be treating ulcer and treating ulcer. See this other, and it's still angina. Just suddenly might just progress to involve to get to be more severe, to now become that the real heart attack that will now result in death. That is just one of several. We call them non-modifiable risk factors. Please permit me to just you know, the things that will cause heart attack.
Yes.
They are not one.
Okay.
They are a constellation, a combination of several risk factors. So some of them, there is nothing we can do about them. They are they are non-modifiable. One of them is age. You cannot do anything to your age. If you are 40 and above, you are 40 and above. One of them is family history. Either or both parents had heart attack or stroke. That means the person may likely have. So you have to be careful. The third is male sex. It is commoner in male than in female, up to around the age of 55 before it now becomes equal. Then the last is family history. I say family history. Race, we are all blacks, so it's commoner in blacks. Personal history, somebody that has had similar experience before is likely to have again. It's not the kind of I've had my own, it is now remaining the hair. You can still have again. So these are non-modifiable. You cannot do anything about them. You really have to know and acknowledge the fact that I have this likelihood of having this. The other categories of things are things that we can do something about. We call them modifiable risk, including being hypertensive, being diabetic, being fat, obesity. And I've said it here before that being fat is generally bad. It's now worse when it is abdominal obesity.
Okay.
You know, men, that is our type of being fat. You see, it is only the tummy that will come out.
That becomes fat.
So that one is even much more dangerous than the other type of obesity. We said imbalanced cholesterol. And that we have the good cholesterol and bad cholesterol. The good cholesterol must be high, the bad should be low. But when you have it reversed, then there may be issue. Excessive alcohol intake. You know, traditionally this is what we have described, excessive alcohol intake. But now, WHO made a release January 4th this year that no level of alcohol consumption is safe. You know, cardiologists, that's what some of our clients say. They told us that when you take this care, no level of alcohol is safe. And I have to sound this also. You know, it is good when you said age, our youth should hear this. When we now find heart attack in younger age group or sudden death, I was with my medical director some weeks ago, maybe like 2-3 months ago. We're called for an emergency. A young man, 26-year-old, had sudden death. He didn't put cardiac death because he smoked or sniffed something. You understand? That resulted in his own sudden death.
26 years of age.
Yes, sudden death. So you see that when we say age, with the way our lifestyle is now, so any age can be affected. We have seen 16-year-old with sudden death. Wow. When I got to alcohol, I have to involve other substances of abuse. You understand? Even smoking. No, traditionally when we say smoking, I had a client. I said, "Do you smoke?" Say, "I don't smoke." Ordinarily, I would have said, "Okay, you are fine." I have to now remember to say, "Do you sniff? Do you take?" You know, they have different ways they call it. Somebody don't say, "I do you smoke?" I don't say, and they say, "I take shisha." So now you take again. So you have to be sure that. So all those drugs of abuse, they can actually predispose the person to sudden death. Then taking hormones.
Okay.
Some people use it to build muscles. Some like some women, when they attain the age of menopause, they still feel like they want to see the blood. They now take hormone replacement. They may be at higher risk of heart attack and several other ones. I must say, sir.
Yes, please.
Poor sleep pattern is an independent risk. We have said an individual should achieve between 7 and 9 hours of sleep daily. So about 4 to 6 hours should be at a stretch. Not that after 1 hour or 2 hours I wake up, or I want to check my phone, I want to go to the toilet. No, at a stretch. That is when the brain is able to refreshing itself and be able to get ready for the next day. And so poor sleep pattern is also an independent risk for heart attack and sudden death.
I think that one is for me actually. Thank you so very much. You can send in text messages or WhatsApp messages to ask my doctor, Dr. Lukman Karim, questions in line with our conversation. Sudden cardiac death. 0904-082-1061. That is 0904-082-1061. And of course, you can call in to speak with him directly on 0904-081-1061, 0904-081-1061. Now, doctor, when you were talking about this family thing, being hereditary or not. Now, let's take a look at a family that maybe one of the parents, either the mother or the father, has this history. What are the tendencies that such children from that parent would also have this same issue? Is it something of a 50-50 or a 60-40, 70-30? What are the chances like? Because most families, it's either the father has it or the mother. What is the fate of the children?
Thank you very much. That question is not, there is no straightforward answer to it.
Okay.
Because when there is a positive family history, it shows that the person is likely or may have. And it is not so we say there is a genetic thing with environmental influence.
Okay.
Usually the instances, look at identical twins, they have about the same genetic composition. If a twin has myocardial infarction, sudden death, the second twin is likely going to have. But then we will now look at the lifestyle of that person. If the other one does, he smokes, takes alcohol, lives a reckless life, and the second one does not do all those ones, the environmental part may now come into play to save the other person. So even when either or both parents have this issue, it is not 100% that the person would have, and we cannot put a value to it. However, the lifestyle of the person matters. If he doesn't take alcohol, does regular exercise, do all those ones that we prescribe, then the person may not have. But then it should prompt the person to go for checkup.
That should be a reason to
Yes,
want to go for a
yes,
checkup,
checkup.
for the fact that either the father or the mother has it. Now, doctor, let's look at how to prevent these. I want to believe there are preventive measures. Even before we start talking about is it curable, are there solutions to it if it happens? How can we prevent it? What are the preventive measures when we talk about sudden cardiac death?
Thank you. Prevent, from the risk factors I said earlier, you can
Yes.
prevent. I made mention of certain or a category of the causes or risk factors that are not modifiable. You cannot do anything about them. If you are 40, you are 40. If you are 45, you cannot do anything about your age. You cannot do anything about your family history. It is there. You cannot change it. You cannot erase it. Whether you travel from here to the UK or US, the family history follows
Still
you
there,
there.
it follows you.
Yes, so you cannot do anything about that. And the others that I mentioned. However, the modifiable ones that can be modified is the history of hypertension.
Okay.
It should control high blood pressure.
Mm.
We had a discussion on this World Heart Day with my doctors, and one of the things we have said that we were actually encouraged to do for those that are not hypertensive should not be hypertensive. For those that have hypertension, should be treated to target. The blood pressure should always be lower than 140/90 if there are no other issues. For a few categories of patients, we say it should even be lower than 130/80. So one important way to prevent heart attack is ensuring that your BP is at target. Well, now I'm talking about the outcome now.
Yes.
I'm not talking about whether you go to the hospital, whether you take drugs, whether you swallow herbal medication. What you are saying is that ensure that BP done is at target, lower than 140/90. If your doctor has told you our target for you is less than 130/80, ensure you are at target. And that has to be done by drugs that are known to do it. That is number one. Number two, diabetes is an important contributor to having heart attack. So if you are diabetic, ensure your blood sugar is treated again to target. If you use a glucometer that reads in 5, 6, 7, the sugar should be consistently less than 5.6. If you add one that reads in 100, it should be consistently less than 100, not 120, 130, 140. And having a slim body shape, not being fat, is very, very important, particularly abdominal obesity. We might be slim from head to that abdominal part, then the abdomen will now shoot out. So ensuring you maintain adequate weight is very important. They're not taking alcohol, not smoking, and not doing other things that are related to smoking. I'm emphasizing that.
Yeah.
And that is where our youth, that's one should go
The
to
likes
them.
of shisha and others.
Yeah, and the rest of them. And all those other ones that they mentioned. I gave a lecture somewhere, and a young man followed me and said, but they said the cannabinoid in that substance is not going to kill somebody. There is no level of that is safe. Somebody also told me, one of my clients told me that yes, I don't smoke ordinary cigarette, I take weed, because they said weed is good for the heart. I said, who said so? So these substances are bad. They should not be taken. They have several ways they damage the body. You see, let me just say something.
Yes, please.
When you inject yourself, you understand, the substance injected is one. That injection that you have done, the needle itself, can give a terrible infection to the heart. We call it infective endocarditis. The success rate of treating that around us here is very low. So basically, substance abuse we should avoid. Ensuring that you are not taking anything that will increase your cholesterol.
Okay.
So all this you see they boil down to lifestyle modification, which is what we talk about now.
Yes. Let's talk about the lifestyle modification. But before then, let's talk about blood pressure now. Your BP. What's the normal number or figure, or what is it called, for someone to feel like, okay, I'm still on the safer side? When it gets to this particular point, I need to see my doctor.
For adults more than 18 years of age,
Okay.
it is 140/90. Should
140,
be less
90.
than 140/90.
Should be less than 140.
140/90 is already hypertension.
Hmm.
So it should be less. Okay, let me briefly classify hypertension.
Okay.
What we do, Nigerian Cardiac Society, European Society of Hypertension, and American College of Cardiology, what we say is any value less than 120/80 is optimal. And that means that is the best. So your BP should be less than 120/80. When it's between 120 up and between 120 and 130 up, between 80 and 85 or 84 down, you say this is normal. We won't say it is normal. But then know that when we say it is normal, it doesn't mean it is the best. So the best should be consistently less than 120/80. Then when it is between 130 and 140, we call it high normal. Between 85 and 90 for the lower part.
For the lower.
Yeah, that is high normal. I recently saw a client that had a value around between 130 and 139 and 85 to 89, and already has future issues with the heart. You understand? So what we are saying is that these are variable. These are 6 categories of normal. To put them down, anything 140 up, 90 down, that's systolic and diastolic, and more is hypertension.
Thank you so very much, doctor. Let's see if we can take this first call. Hello to you.
Hello, Okwe.
Yes, good morning. Your name?
My name is Sabado calling from Madibu.
Please go ahead, talk to us.
Doctor that I want to talk to.
He can hear you clearly.
Doctor, please, what is the cause of brain tumor?
The cause of brain tumor. Okay, just stay with your radio. Your question will be attended to. Thank you very much, sir. Okay, so maybe we should just attempt his question before we move ahead. He's talking about brain tumor.
Brain tumor is a big thing. It is what that means is that there is a growth in the brain. It can just occur sporadically. Then it can also follow. Some people have certain genetic predisposition, and there is no particular cause of it. It can just come. Apart from it is a form of cancer.
Okay.
So several other things can be involved. It can even occur in children. Depends on how it is. So it can be congenital. It can be something that is acquired. There is no. You cannot lay hand on a particular thing that discussing that.
Thank you. Hello to you. Good morning.
Good morning.
Yes, I was about taking your message from here.
Okay, there's no point.
You want to talk about sex? Please go ahead.
All right. Doc, good morning, sir.
Good morning, sir.
Yeah, I think I've missed you. We've met one on one, but you don't know me. Anyway, let me leave that by the side. You've done a great job this morning. At least I'm learning new things about cardiac arrest and heart attack. Normal, I think both are together. But now, from your explanation, I know that there are 2 different things. But sir, when you're ruling out the cause, you omitted one part. What does the role of too much sex, or do I put it, an enhanced sex, have to do with cardiac arrest?
Sex.
Yes, sex. And some people, because they want to meet up to one standard, they enhance themselves before sex. So I want you to just help us to share more light on this aspect. Larry from Ikorodu.
Thank you very much, Larry. I was going to take your message, however, but thank you for calling. So he sent a message. Maybe I should take that so that it could be very clear. He said that, great job, Doki. Please, sir, when you were saying things that can cause it, you did not mention too much of sex. Don't too much of sex cause cardiac arrest? Larry from Ikorodu.
Okay, the question is again more straightforward. What is too much sex? So I must say that having regular sexual intercourse with your partner is not a risk for heart attack.
Okay.
It is not. When you now say too much sex, I don't know by which definition will sex will now be too much.
Too much.
But what is not good is that you enhance sex when with certain drugs that are not prescribed by the doctor. If like I had a client that said, "Doctor, this thing is not doing well. I want to use a particular. I don't want your drug. Somebody gave me something to use. It's ABBA. When I collected that, I look at it. It is actually our drug, orthodox drug, crushed and other things added. And the person, the maker of the drug, actually was sincere enough to put the dose, very high dose of that orthodox. Imagine the person now taking two. It came in like a sachet, like this tea bag.
Okay.
And it looks like that.
Okay.
The person now feeling like I want to enhance this thing very well. Now takes so that is already overdose. So that kind of a person may now have, because that same drug can even crash the blood pressure. And some of those drugs can actually they can interact with one another and cause cerebral heart attack. There is a particular drug we use to take care of the heart with nitrates. Some of the drugs that they use for as enhancer, if they interact, it can bring down the BP of that person so drastically that the person may even die on the partner. So to give summary to that is that regular sexual intercourse is encouraged within the family. But then when you now enhance it unduly, there are various substances of abuse that people take to enhance sex. And if that, of course, to even take such drug, I know some of our colleagues have referred somebody to me. They want to assess the status of the heart before they give a particular. That's a doctor that knows what he or she is doing. Not that everybody, and this the advert here and there, that until you have 10 rounds per night before you become, maybe that is what you now say too much sex.
Too much sex.
From what we know, having 1 or 2 in a night, 3 or 4 times in a week will not be too much. So I hope that answers the question.
Thank you so very much, Doki. And to add to that, Mr. Larry, there is nothing like too much sex if you're doing the right sex. So the little I know sex is good actually.
That is another thing. You know, I was having a discussion. My doctors asked me, just similar to this.
Yes.
So for now, this day and age now, you have to ask somebody, what do you mean by sex?
Okay.
Because people do different things and they still term it sex.
As sex.
You understand? So if it is the traditional one that we know, then it doesn't have anything to do with it.
Another messenger from WhatsApp here. This will be the second one. This person wants to know, how about those that have... Let me just rephrase it. This person is talking about hard job. For instance, welder, Friday. This person's name is the person's name is Friday, and he's saying, how about people that do hard jobs like welder? That message is not so clear, but I think this person is trying to say that people like that, do they have the risk factor of being hypertensive or might have this sudden cardiac death?
Okay, one of the ways to prevent heart attack is to do regular exercise. So usually when we give this kind of lecture, people will now ask that, if I do hard jobs, I'm a bricklayer, I'm a welder, I carry everything. Would that amount to exercise? No.
It's quite different.
Exercise has its own characteristics. We call FIT. Must be frequent. It has a particular intensity. It has the time. That should even, I do it in the morning, I do it in the evening. And it has duration. Should not be less than 30 minutes. So if you have anything that you do that should, it is fit. So it should fit into this. So that is when it is exercise. I carry cement from 10 story building down. That may not constitute exercise. However, we call that one physical activity. It also still contributes to health. It is a lot better than that one that sits at home 24/7 without doing anything. So if I get that question right, if you do hard job like welding or carpentry or bricklaying, it is only physical activity, may not constitute exercise. To have better health from exercise, you have to engage in exercise that is of regular frequency, about 5 times per week, that is of moderate intensity, that has a duration of at least 30 minutes, and it is something that you do regularly.
Okay, let's take another call from here. Hello to you. Good morning.
Good morning, sir.
Okay, Mr. Larry, talk to us.
Mr. Larry calling back.
Yes.
Dr. has said part of my other question.
Okay.
I just told a friend to listen because while talking with this, my friend, he believes enhancing himself and going like 10, 15 rounds to him is
in a year.
Classification. No, in a day. In a day. That's that is his mentality, and it was part of the reason why I asked that question. And I've told him to listen, and I follow up. I know that he's listening. He prompts me to ask this question. He announced himself, and he goes 10, 15 rounds. Wherever he goes, I don't count. But he said he goes this round. Now I used to tell him that you went 1, 2, 3 rounds. The heart on its own needs rest. The brain on its own needs to process this already job that you've done. They want to renew their energy. They want to do any other thing. But you're not giving that brain rest. You're not allowing the brain to rest. Now, you are enhancing yourself again. Putting too much load on the brain and on the heart. Pumping excess of blood. But I know he's listening now. I will let the doctor to even slide this, so I'll drop it. So that is more of the reason why I asked that question pertaining to sex.
Thank you, Mr. Larry. And you can do well. Hello, can you hear me?
Yes.
You can do well to share the link to your friend. We are live on Facebook, so he can actually watch live on direct. Yes,
I'll do that now.
Thank you very much.
Thank
you. So coming back to you, Doctor, I don't know. Do you have something to say to what he just said?
Yeah, I think it's just where we have answered. Thanks for saving a life, brother. But then the excess amount of enhancers is bad.
Definitely. So doctor, tell us now, when we talk about this sudden cardiac death, you said something earlier while you started this conversation that sometimes it happens within an hour and then boom, the person is gone. Then what should happen? Because sometimes it is to say that before they get to the hospital, the person is dead. Then what is the solution? What should we do when people around us are being attacked with this sudden cardiac death? What should be the next thing for us to do?
Okay, fine. Before I go that's direct.
Okay.
The first thing to do is that when you have a risk, anything that can cause cardiac death, take care of it. You are hypertensive, take care of your hypertension. You are diabetic, take care of diabetes. You have been told that your cholesterol in the blood is not balanced. The good ones are low, the bad ones are bad. This combination is terrible. Take care of that. You take alcohol, reduce or stop. You smoke whatever or you sniff whatever, avoid them. Don't take hormones for whatever reason. You are able to do all this, and so you prevent all this. That is one step. Now, for those that now have what may now translate to heart attack, we have said the people that will be symptomatic, they will have chest pain. If you have such chest pain, make your way directly to the hospital. There is this drug, we call it aspirin. Can be chewed, not swallowed.
Okay.
If it's sudden onset severe chest pain, just take. Our people will know what we call Vasoprene. Is aspirin, low dose aspirin. A dose of that is 75 milligrams. Just take 4 tablets, and this is to get you to the hospital. It is not the final treatment.
Okay.
So let us get that clear. Like you have asked now, you are listening to this program. This should be the take home for you. You have a chest pain that I think, I may not survive this. I said something, angonimi is a feeling of impending doom. When somebody has that
angonimi,
yes, when you have that pain, you also have a sense that I may not survive this. So for people at home, for people that are close by, just get that aspirin. It's Vasoprene 4 tablets. Chew. It should be chewed, not swallowed. Around the tongue like that. That may give a brief relief, or even if there is no relief, it's going to do something to the heart. Then you make your way to the hospital immediately and give exactly the way it has happened.
For instance, heart attacks sometimes are being witnessed from people that are not even relatives to the original person involved. What are the things people need to do? You're at your workplace, one of the colleagues is being struck, and then bam, heart attack comes. What should we do even before saying we want to take this person to the hospital? Okay,
fine. That is that stroke that you said. It is cardiac arrest. Is another thing. You understand? That is, somebody has heart attack. One of the ways is that chest pain. Yes. Somebody may not have the chest pain.
Yes.
We said it.
Yes.
The person will just drop, will collapse suddenly.
Yes.
And the person may be otherwise gone. You understand? You feel the person's pulse is not there. You feel the person. when you breathe in, the chest moves up. Then when you breathe out, the pen moves down again. You are not seeing any such thing. You have called the person, hello, hello, hello. The person is not answering. These 3 things translate into cardiac arrest. So apparently this person is otherwise dead. So at that instance, what we should do is to do what we call CPR.
Okay.
Cardiopulmonary resuscitation. And that is by putting your hand very straight. The elbow will be very straight. You kneel down by the person's bed. Of course, the person would have laid on the floor because the person has collapsed. So immediately get to that person's side. Remove all the clothing there. Any tight fitted cloth should be removed. Then you are now using the heel of the palm. The heel of the palm. You are doing. You put the 2 of them intertwined together, and the elbow is straight. Then you compress the chest compression. That chest compression should be done centrally. The lower half of the chest. that is where, not on the left side. Yes, the heart is on the left side.
Yeah.
But for this to be successful, it has to be done central chest, and it should be on the lower part of that central chest. And there is the heel of the hand. When they are already intertwined together, and the elbow will be straight, and you are pressing as deep as possible, as deep, or let's say as fast and as hard as possible.
As fast and as hard as
this
possible.
person is otherwise dead. So you need to bring this person back alive, and this is the single most important we can do to get the person out. You understand? Really, we are in a meeting, or we are standing in the garage or wherever. This person suddenly collapses. Instead of running scatter, get close to this person, ensure that the environment is safe. Let us note that. That is just maybe one of the electricity cable just falls on somebody. Without taking special caution, you just go in there. There will be 2 casualties.
Definitely.
So ensure the environment is safe for you to rescue the person. As you get there, the first thing, just get all the assess the person. Is this person still breathing? If he's still breathing, that means assess the cardiac. You check the pulse. Usually the center around the neck. There is a place you put your hand there and check whether this person is still having the heart actually still working. If all those are not, and you have called this person, is not responding at all. He's not even making any gesture with the hand or anything. Somebody may fall like that and say be telling you that I cannot talk, and that person is not in cardiac arrest. But this person, these 3 things I have said, is unconscious, he's not responsive. That means he's unconscious. The pulse, is not there, and the person is not breathing. You look at the chest, he's not moving at all. This person, immediately you start the chest compression as a component of CPR.
Let's take just one more call before we leave. Hello to you.
Hello, Uncle.
Yes, good morning. Your name, please?
Good morning. Baba Center from Alugba.
Thank you very much for calling us. Talk to us real quick.
I'm asking the doctor, what normally causes nagging or temperance?
We didn't get that. Can you say that again?
Nagging or temperance.
Margin or temperance.
Temperance.
The doctor is not getting that. Is there any other word for what you just said, sir?
Igbonora.
Then.
Temperament.
Okay. Temperament. Oda.
Temperament, please.
Okay. Is there any cause for temperament?
Yes. What now they cause it?
Okay.
Does it affect brain? Does it?
Okay. Thank you, sir. Let's see if we could attempt that question.
He is a personality type. And if you ask me, can temperament contribute to heart attack? Yes. There is what we call personality type A.
Okay.
Somebody that is a perfectionist. Hey, such people are at risk of heart attack. This place is not clean. We saw where it's not yet clean.
Everything they are hyperactive.
Everything has to be done 100%. Such people, and they get angry easily. You come to the office, this is not there, this is like that. You call it personality type A. They are at risk of heart attack. If that is what, but then being temperamental is a personality thing. You can also control it.
Definitely. Yes. Doctor, our time is fast spent. We have to leave the studio, but I don't know. Maybe we should take the calls that are just coming in. Hello. Yes, you have just 30 seconds. Talk to us. Okay, I guess you're not ready. I am sorry, we can't take that call anymore. Now, let's go to WhatsApp. Somebody here is saying, Mrs. Shona here, she said that can Vasopin be taken every day? Good morning. Thanks for the job. Well done. So this person is saying good morning to you and well done. And that can Vasopin be taken every day?
Thank you, Ms. Shona. No. If there are no indications, no. It is a drug of prescription. It is not like a drug for all diseases. No, it has to have its own indications. So see your doctor. If you require it, then you take.
Okay, let's take one more. Hello.
Hello. Good morning. My name is Friday.
Your name is Friday. Oh, okay, Friday. Talk to us. Just 30 seconds, please.
I want to ask this question. As a married man, since they are talking about something sex, because I don't. So I want to ask, as a married man, how long can a man stay not having an intercourse with the wife, and those to have an effect on that man?
Okay, Friday, let's get this clear. How long can you stay as a man while having sex? Or how long can you without having sex?
Without.
Okay, let the doctor do justice to that. Thank you, Friday. Thank you.
Okay, you can stay as long as possible. We have father, the people we call fathers are the heads. You can stay as long as possible. As much as you don't expose yourself unduly. When you now watch things you're not supposed to watch, you be aroused. You can then, if you don't have word dream or things like that, but you can say as much as it's a partner of personal discipline.
Okay.